Matters of the Mind is a live call-in program where you have the chance to choose the topic for discussion. Matters of the Mind is an opportunity for anybody in the general public to either just listen to a psychiatrist talk informally and casually, and that's what you're trying to increase with the treatment of ADHD. I was asked back in 1998 to host a series on PBS called Modern Parenting. And it was a 13-week episode where I'd bring on local therapists as guests, and we'd take calls from people having parenting issues. Well, from there, Claudia suggested that I just do a psychiatrically based program, and I was thrilled to do that. We did about 6 months worth of very specific topics like depression, post-traumatic stress disorder, panic disorder, eating disorders. And after doing that for about 6 months, the question was, why don't we just start doing a live call-in? So the live call-in is what really took off and continued over the course of the subsequent 26 years. Some of them do get across the blood-brain barrier, and they can cause you to have some memory disturbance. I had some well-meaning colleagues back then. They told me, you have no business going into broadcasting and doing a live program where you get real calls. What's the matter with you? They're going to call about all sorts of things. You're going to lose your credibility. You're going to be embarrassed on the air. You can't do a live call-in with a psychiatric topic. I said, well, I'll give it a try. Back in the 1990s, when I started Matters of the Mind, there was a tremendous amount of misperception about what psychiatrists did. There's a lot of mystique to what psychiatrists did. Think about mental illness as being something that affects this brain of ours in a similar way that heart disease affects the heart and kidney disease. I began it with this model of the brain. A mental health issue, a psychiatric condition, is related to a brain abnormality. That's where it starts. So I talk about generalities concerning what somebody might be enduring with their silent suffering of a psychiatric condition. And I try to let people know there's hope for treatments, and I try to allow people to understand that they're not alone. The purpose of this program is to not try to diagnose or give definitive treatment to any one individual. I can't diagnose somebody in 2 or 3 minutes in just hearing their stories. It's a very informal type of discussion. I'm not talking to them as I talk to doctors. I don't talk to them necessarily as I would somebody in my office setting. I'm not talking to them as a patient. I have a footstool, and the reason I have that footstool there, I have my feet propped up. People might not notice it until they see the final shot at the end of the show, but I have my feet propped up the whole program. I do that to remind myself I'm not in a clinical setting. This is like somebody coming to my living room and just having a discussion. Let's go to our next caller. Hello, Greg, welcome to Matters of the Mind. People will ask me what's in the cup. I use the cup not only as a prop, but I will use the cup, I have used it historically as a signal to change camera angles. In the cup, it used to be coffee 25, 26 years ago because I was tired. I had worked a whole day, and here I'm coming into a live studio and I was tired. Over the course of the years, it changed to the point where now it's diet soda. But originally, my biggest apprehension was starting that program on time and ending the program on time. Can I tell you, it's anxiety provoking to have that countdown, 5, 4, 3, 2, 1, and you feel like you're in the space shuttle and you're getting ready to take off. I used to have palpitations when I was first starting the program. Now, I'm so relaxed, I have to have some caffeine.